Hello, I am Johan Nijts. I am a professor of virology at the University of Leuven in Belgium.
I am Yannick de Bing. I'm a pharmacist and a third-year PhD student in Johan's lab.
We will present our recent paper in gastroenterology, which is entitled "A Mutation in Hepatitis E virus RNA Polymerase promotes its replication and associates with failure of ribavirin treatment in recipients of organ transplant." The study is a collaboration with the group of Professor Heiner Wedemeyer at the University Hospital in Hanover, Germany. 15 solid organ transplant patients with chronic hepatitis E were treated with ribavirin. All patients cleared the virus except 2 who were non-responders. The first patient received 1 course of ribavirin, and following treatment the viral load decreased, but even during treatment a viral rebound was observed, and following stop of treatment a fulminant hepatitis developed and the patient finally died. A second patient received 2 treatment courses of ribavirin. Following the first course there was a sharp decline in viral RNA, after which the treatment was stopped and there was a viral rebound observed. In the second treatment course, viral load decreased again, but following stop of treatment, the viral load increased again. The viruses were sequenced before start of treatment and at several time points during and after treatment. A mutation at position 1634 of the RNA-dependent RNA polymerase was observed, which was a glycine to an arginine, which was the case in both patients.
The presence of arginine at position 1634 has been observed in a number of isolates, and also lysine is a possible residue at this position. The clinical pattern that we observed reminded us of the development of resistance against an antiviral drug. And that's why we introduced this mutation at position 1634 into a subgenomic hepatitis E virus replicon, and we tested its sensitivity to ribavirin in vitro. As you can see in panel A, these are the dose-response curves for the antiviral effect of ribavirin in glycine and arginine, and as you can see they overlap, there's no difference, no resistance is observed. What we did notice during performing these experiments was that arginine and lysine yielded a consistently higher signal than the original glycine, and this was true in 2 different hepatoma cell lines, suggesting that arginine and lysine may replicate better than the original wild-type glycine strain. To test this hypothesis, we assessed the replication kinetics of the glycine, arginine and lysine variants over a time course of 20 days. And as you can see, lysine and arginine replicated faster than the original glycine strain. This was the case in a control condition, but also in the presence of 2 different concentrations of ribavirin. To compare the fitness of the glycine and arginine variants, we performed a competition assay. In this assay we made mixtures of glycine and arginine at different concentrations, and then we assessed the fraction of both variants over time. And as you can see, the glycine variant is outcompeted by arginine over time in all 6 different conditions.
In conclusion, we observed a mutation associated with ribavirin treatment failure, which results in increased fitness of the virus and which may explain the observed clinical picture. We would like to thank the patients who contributed to this study. We thank our collaborators in Germany. Thank you for watching.